You're listening to Crashes, Claims, and Clarity, hosted by Darrell Burrow, a Georgia-based personal injury attorney with over 30 years of experience and founder of Burrow and Associates. With a background in both legal strategy and compassionate client care, Darrell has helped over 10,000 individuals and families navigate life after injury. Guided by his Christian faith and a deep sense of justice, he brings expert insight, personal stories, and powerful interviews to every episode. If you're looking for truth, support, and clarity in the aftermath of an accident, this is your place. This is Crashes, Claims, and Clarity.
Well, hello everyone, and welcome to another episode of Crashes, Claims, and Clarity. I am your host, Darrell Burrow. Thank you for joining us. I am the founder and owner of the law firm of Burrow and Associates. We are a personal injury law firm here in the state of Georgia with our headquarters here in Duluth, Georgia, that's in Gwinnett County. Today I have the distinct pleasure of being joined by Joseph Kostuch. And today we are going to be talking about recovery again from workplace injuries, automobile accident injuries, and other injuries. But we're going to be focused on the realm of how physical therapy plays a part in that recovery. Joseph is a physical therapist, and he is with HPRC Physical Therapy. They've got several locations in and around Atlanta. At the end of the episode, I'll have him tell all about how we can find him and his practice locations. HPRC stands for Human Performance and Rehabilitation Centers. And again, we'll shout out those locations at the end of the episode. So Joe Kostuch, he graduated from the University of Wisconsin in 1997. He's actually been with HPRC since 1998. He's a board certified clinical specialist in sports physical therapy. His specialties are shoulder and extremity injuries. He's also been very active in the profession and held some leadership positions. He's been the past district director of the Physical Therapy Association of Georgia and also the past president of the American Society of Shoulder and Elbow Therapists. Well, thank you so much for joining me today. I appreciate you coming on.
Thanks, Darrell, for having me. I appreciate you reaching out.
Yeah. So first off, just tell us a little bit about your history. I did a very brief intro, but tell us about how you got where you are.
Yeah, perfect. I guess I don't know what Google would come up with me, but I did my training and grew up in Wisconsin and got interested in the field of physical therapy through sports injuries in high school, and kind of early on determined I did not want to be behind a desk and wanted to interact with people, and always had a strong interest in the sciences. So PT, I had a positive experience as a young athlete and went through my training in Wisconsin and met my wife while in college. And then we headed down to Georgia then shortly after graduation. And during that time, I've been very fortunate to be with my group, HPRC. We've actually have gone through a couple name iterations over the years, and a little shout out, we're, I believe, the second oldest kind of therapy private practice in the country. We've been in existence since 1955, and we are based out of Columbus, Georgia, is where I practiced for about 24 years. And then over the last several years, I've moved more into kind of the Athens and Atlanta markets. So,
Okay. And what brought y'all from Wisconsin to Georgia?
yeah, so my wife had family that lived in Athens, and we, you know, being, I guess, early 20s, we decided that the warmer weather sounded nice to us. And so we could always move back. But the fact that we kind of headed south for the warmer weather, we're still close to family. And, the group that I started with in Columbus, I've been fortunate enough to form some real lifelong relationships there. And, I think people move for a lot of different reasons, but, work being one of them. And my wife and I have always been very fortunate to have great employers that have meant a lot for us and supported our family. So, we did a little relocation a few years ago when our girls finished up high school and moved on to college, but been fortunate enough to stay with my same group.
Okay, fantastic. Well, let's kind of jump right in. So you're seeing a patient for the first time after an automobile accident, work-related injury. What are kind of the first few important things that you want them to know about recovery and also recovery time frame?
Yeah, so, you know, in the state of Georgia, we're able to see patients on a pretty widespread basis now without a physician's referral. There are still some cases where we do require that or insurance requires that. So, you know, you first want to make sure that they've had the appropriate screening done. So we're not able to order imaging, x-rays, MRI. We're not able to prescribe medicine. So if we're seeing someone acutely within that first week per se after an accident, we want to, rely on our training and screening. And if this person has some, significant red flags, white flags that they need to get in and see, that type of professional in our field, we need to help coordinate that. And that's kind of, the first priority. Not saying that we can't be effective in providing them some level of care to start to feel better, but we also need to kind of rule out more significant or serious injuries, which sometimes we need the help of, other professionals in our field. So I think it's important if you are, as an injured person, a victim of an accident, seeing a therapist is a great first step because we can help you start to feel better quickly, but we also then need to rely on our other partners in the medical field to, collaborate with, make sure that there is nothing more significant wrong from an injury standpoint, make sure they're stable to participate in therapy. So that's important to kind of lead with that.
Okay. And my understanding is that an individual who's been injured can see or have physical therapy treatment for up to 8 visits. Is that correct?
Yes, or 21 days. There's kind of a visit or a
Okay.
time frame on that. And then after that, then we need to consult with another medical professional, typically a MD, DO, something of that nature.
And that wasn't always the case, right? And when did that change?
Oh, now you're putting me on the spot. It's probably been within the last 10 years, and
Okay.
it's state by state. It's not federally regulated, but in our world, it's called direct access. And we've had that in the state of Georgia for, I'm going to say 8 to 10 years. I'm going to be pretty close on that. Unfortunately, like a lot of things in our field or the medical field, it's driven a bit by insurance. So, you can legally see a patient, but whether an insurance company wants to pay for that treatment is another thing. So, we still are not able to see patients who are federally covered by Medicare, Medicaid, but most all of the private insurers will allow us to visit with patients for kind of that 8 visits or 21-day window
Okay.
before consulting with the different medical professionals. So it's been wonderful. The saying I think within our field is if you're sick, you go to a doctor. If you're injured, go to a physical therapist. And so it's a very simple way to think of it. And, for a lot of sprains, strains, ankle injuries. I mean, kind of moving out of the injury world here, we can be a great access point for people that are injured that we can get them in quicker. And if they do need to get some imaging or medication, we can usually get them routed to a physician, maybe a
Yeah.
little quicker than they're calling on their own.
What do you see as the symptoms or indicators that people kind of underestimate as being kind of a big problem?
Yeah, I mean, if we're looking or talking about the, post-injury population or, we'll take a motor vehicle accident, there's obviously some initial trauma and that doesn't come all at once. I mean, there's obviously, the first 24, 48 hours, you're still feeling new things, so, at the scene of an accident, a lot of times you may be checked out by an EMT and then determining whether you need to go to the emergency room for further evaluation. But that all changes. That's pretty fluid within the first couple days after an accident. You're still realizing a lot of new aches and pains, that may not have been there originally, just due to your body's reaction to that situation. So that first week, it's important just to, you know, one, constantly just be reassessing what you're feeling and know that a lot of that is just very normal after the course of an accident, and not to underestimate what you're feeling. I think the point where our expertise can come in is, okay, what's maybe kind of a normal, I don't want to say normal, but an ache or a pain related to just kind of the trauma of the accident versus what's more of like an injury or like a pathological problem. Like, is there a fracture that we need to look at? Was there a dislocation or relocation that occurred during the accident? Was there some more significant soft tissue injury? And in that first week, those can often be tough to discern because you're still dealing with the initial trauma from the accident. But as that first, and I'm using maybe a week as a time frame, but over the first week or two of treatment, a lot of those general aches, pains, soreness, start to dissipate. And then you're able to get a little clearer clinical picture of, okay, maybe I need to focus a little more on this right shoulder that, was grasping the steering wheel and all of a sudden had a pretty traumatic injury in the accident. And, let's focus our attention on this in a little more detail.
And I know you've been doing this a long time and seen many, many people. I bet you're at a point where, and I know you're going to do a history and ask the question, so you're going to know this, but you could probably examine someone and know, okay, I can tell they've been in a rear end accident, or this was a T-bone, and what are those symptoms that you see again and again and again and again?
Yeah, good point. And right, getting an accurate history is important. So obviously you get injury or trauma from the impact, and so the direction makes a big difference. So you're exactly right on that, that certain presentations are more specific to certain types of injuries. Obviously neck and back are probably some of the most common. I alluded to kind of shoulder wrist issues from kind of holding the steering wheel. A lot of times lower extremity injuries from a front or rear collision if you're bracing your lower extremities against the base of the car. So there are certain injury patterns that are very specific to different types of accidents. So getting that thorough history, as well as the patient can recall it. Sometimes, they don't have a good recollection of the exact, mechanism of injury, but it's important for us to gather that history and kind of put all those pieces together. And if we do then know, okay, they've got A, B, and C, then there's a greater likelihood that they're going to have D and E also, based on the type of accident that they have. And that may not show up, during that first initial week or so, but those are all kind of good conversations to have with the patient, that this is, going to evolve a little bit over time.
Okay. And as you get into treatment, what are some of the techniques or exercises
Yeah.
or modalities that you employ to get people better?
Perfect. So when you look at recovery in kind of some different stages, so the first stage is kind of that acute phase, and you can give that a time frame of maybe 7 to 14 days, depending on the severity of the injury, that you're dealing with just a lot of that normal soreness and trauma. So, it sounds very basic, but just keeping the patient moving as best they can, going through their daily life, you know, as much as their injuries will allow, to get them back to their normal daily functions. If work is a consideration, get them potentially back doing some limited days at work. What we're doing during that phase is helping to control their pain, swelling, restoring their range of motion. So there's various, like you said, techniques and modalities. Some of the modalities, basically, on a very basic level, excuse me, is kind of ice and heat, and those are kind of old, tried and true, but those are very good if there's, kind of joint specific areas that require that. When we talk about range of motion, just your ability of a joint, your back or your neck, to kind of go through a pain-free, normal range of motion. So, and we need to determine whether that's being limited at any joint, if that's limited by more of a mechanical obstruction, or whether that's more of a soft tissue pain, soreness, tightness limitation. And depending on what we find, then we're going to treat that differently. If it's a muscle that's real sore, tight, and guarded from the trauma of the accident, there are different techniques we can do, both manually to try to, I want some type of a massage or a trigger point. There are some dry needling techniques that we're able to utilize to release muscles. We can also use modalities such as ultrasound and e-stim. So we've got a variety of different interventions at our disposal to, one, help to restore that normal mobility, help get that pain level, more and more manageable. And we use the term kind of getting to a predictable point of pain. So, when someone's real acute or unstable is probably a strong word, but when they're, when you kind of come in and everything hurts, that's kind of not a predictable pain pattern. But you give that a week or two, you work through things, and then you get to a predictable pain where they come in and say, I could really do fine, but every time I reach behind my back, my shoulder kills me. So, when you can get to some predictable pain patterns, that's when you can start, treating those more specifically and then kind of honing in your care.
Okay. I'm sure you incorporate certainly heat and ice therapy for a patient at home, but are there other things, or is it a good idea or not a good idea to have them doing other things at home other than ice and heat?
Yeah, so absolutely. And I think, when we talk or kind of educate the patient on continuing to move and be as active as their symptoms allow. So, most people now are able to, with between phones and watches, just track steps. And so sometimes we just talk to patients about just, going out to the mailbox, walking around the block, things that are a little simple, just trying to keep their mobility up and kind of keeping track of that. Most everyone in our care is going to go home with some type of a limited exercise program prescription.
Okay.
We're at the point now with technology that can be fairly customized, that you're going to go home with short little 30-second video clips that you can pull up on your phone that are going to help replicate, some of the exercises that we had you do in the clinic. There is some, tracking software that's kind of included or embedded in that too. So, we can kind of tell whether whether you've opened the app at all or whether you're opening it three times a day.
Okay.
And so it's not a mechanism to police, but it's a tool for the patient to utilize. And, everyone goes in and they have this appointment where they've got a million questions, and then they get told 5 different homework things, and they get home and they're like, well, man, and I don't remember anything. And so,
Right.
to be able to open up that app and get a little summary of things and kind of walk you through that program has been great. And there's been a variety of iterations of that over the years, but, the product that we're using now really does a nice job with that. So, and I know most providers have some version of that, even if it's a, printed out static picture, but being adherent to home movement recommendations, home modality recommendations, home exercise recommendations, all can help speed along your recovery and get you back to, hopefully a pretty good baseline level of function within a relatively short amount of time, until we can determine if there's been some bigger damage done or some more specific, joint specific injury.
Good segue into my next question of how do you combat the folks that, hey, you see the app, they're not doing it, what they're supposed to do, or your instructions for home, but also the person that doesn't show up for an appointment some weeks down the road. And when your staff calls, they say, oh, well, I'm feeling better and I didn't think I needed to come.
Yeah, and that's, it's something we deal with all of our populations, whether it be, athletes, weekend warriors, and or vehicle accident people. So, in truth, I've learned over the years that I do give people a lot of credit for knowing their own bodies. And so I probably didn't initially give that enough credit earlier in my career. So do find that feedback that patients give me as, hey, I'm feeling better. I give that a lot more credit than I used to, and then I have a different conversation with them. But as far as, for accident folks that are trying to recover, it's important because most of the time they're going to have, an attorney involved with their case. They're going to be dealing with insurance companies, and they're going to be looking at this from a whole kind of case in its entirety. So you want to encourage the patient to kind of work through this whole plan of care that's been established, whether it be, us as therapists, their physician that might be referring them, we want to make sure that we're getting you to, not only a point where you feel good and you feel like, okay, I'm back to my normal daily functions, I'm back to work, I'm back to the gym. But if there are some things that we kind of noted in our initial visits or evals that, were some deficits that, measurements that we took that you may not be as attuned to, we want to make sure that we track those and we get those cleared up because, when you're looking back on these cases, in hindsight, having everything documented is important, because these things aren't finished in real time. It can be weeks and months later. And so having a well-documented progression of care, progression of, your functional ability, and we track everything. It's most orthopedic offices, and I know physical therapy practices, we track outcomes, and outcomes are, it's gotten fairly scientific and well documented as far as questionnaires, as far as activities and functions that you can and can't do. And that generates a score. And we track that score over your whole course of care. And, so it's typically on more of like a 0 to 100 scale. And, you may start off at a 30 and the goal is 100. And, you go from a 30 to a 50, and then you call in and you say, oh, I'm feeling great. And then you're kind of like, okay, well, we've got 50 more points, quote unquote, that we need to, gain or show progress on. And when you're going back and looking at a case in hindsight, it's nice to see kind of that whole plan of care come to fruition. And we kind of have a little bit more objective timeline of your recovery.
Okay. I know everyone responds differently, and you might hate this question, but what's the typical time frame of recovery on soft tissue injuries that you see from, an automobile wreck or a workplace injury?
Yeah, and I think there's a lot of factors. I know in kind of reviewing some of the topics that we're going to talk about today, one of the questions, and I don't want to ruin what's coming ahead, but was like kind of how quickly or how slowly, to kind of introduce physical therapy. If we can get to folks fairly early on in our field, that's probably within the first week to 10 days,
Okay.
of an accident or injury, we can prevent a lot of the compensations, and maybe we'll call them like secondary type issues that come from immobility. If you're not doing your normal daily activity for a period of time, well, it becomes harder just to do that. So the quicker that we can get people back to basic function, the quicker their whole recovery is going to go. And, I'd say some of the soft tissue stuff, I'd say on the quick end can be 6 to 8 weeks. I know that doesn't sound super quick per se, but, there's a lot of, as I alluded to earlier, there's a lot of symptoms and trauma that don't necessarily arise during that first week or 10 days when you're just recovering from the incident. And you want to be mindful that it's a kind of an ever-changing picture. And, every time that you're going to come in for a visit with us, with a visit to your doctor, things may change and evolve. And people sometimes feel bad talking about that they're just like, well, I felt, my left shoulder felt fine. And all of a sudden, a week later, my left shoulder is killing me. And
Right.
these are all things that, it's important to have documented. People don't need to feel bad about talking about a problem or a new symptom. And, the question always arises, well, did that come from the accident or injury? The answer for most people is yes, and it just because it didn't appear the time you went to the ER or that first 3 or 4 days doesn't mean it's not from the accident or injury. Those symptoms can sometimes show up a couple weeks later as you get back to normal life and normal activity, and we absolutely need to deal with it. So I think I got a little wordy on my answer, but hopefully I got you
No,
a
it's
general time frame.
absolutely. And it's good to hear that, because what I hear from a legal perspective all the time is from an insurance company or an adjuster, oh, well, they didn't complain about that for, however time frame. They're trying to use that as a tool. And so it's good to know that information and how we, from our standpoint, can combat that.
And the flip side of that then too, Darrell, is you know, pre-existing conditions or injuries. I mean, I think the assumption is everyone, everyone walks around with zero aches and pains and zero pre-existing conditions and no arthritic changes. And, all of a sudden they have an accident and their knees hurt or their shoulders hurt. And, it's compiling something that may have already been a problem. And that's that's something real. And, we need to, as healthcare professionals, we need to address what might be underlying versus what the new acute trauma is. And, on your end, the insurance agent, the end, the physician end, it's sometimes hard to separate those things, as far as what was pre-existing or what's kind of the new injury or exacerbation. But, my goal is to get this person feeling better. And if it's 15% dealing with the new acute exacerbation and it's 85% of dealing with something that's been lingering for 3 years prior, I need to do my best to get them feeling better. So that it's another layer to these patients that we need to take seriously. And, we need to make sure that they feel heard in that too, because that can be unfortunately a bigger complication with some of these cases. And I'm sure you experienced it yourself.
Absolutely. Well, listen, I appreciate you joining me today. It's been very helpful, a lot of great insight. I know everyone will take this information to heart. I would like for you to give a shout out to all of your locations where people can find you. If there's a main phone number, if you've got social media presence, give us a shout out to that.
You got it. Well, thank you. And so we're with HPRC, Human Performance and Rehabilitation Centers. As I alluded to, we're kind of based out of Columbus, Georgia, but we have locations in Conyers, Stockbridge, and Hampton, Georgia, along with Athens and Auburn. So again, we've got a little bit of a footprint. Our website is hprc.net, and you can log on. You can also send a kind of an email inquiry to set up an appointment online, and we can do that mostly through a live chat or kind of the specific clinic location. The phone numbers are all listed. We're fortunate about 5 years ago to partner with a national group, Confluent Health. And so if you're listening outside of the kind of metro Atlanta market, goconfluent.com is the website that would get you in touch with kind of our national footprint. We've got about 800 clinics nationwide that kind of fall under the Confluent Health, and all kind of in this space, this outpatient orthopedic space, which personal injury, motor vehicle accidents is a big part of what we all see. And it's going to vary state by state, but know in Georgia that we can see you without a physician's referral for, again, that first kind of couple weeks to get you started. And then we can work with your, family physician, or if you need to see an orthopedist, and we can continue your care. So
really important. Yep.
Yeah. So I appreciate your time and having me today, Darrell.
Thank you. It's been a blessing. You take care.
All right. Thank you.
Okay. Bye-bye.
You've been listening to Crashes, Claims, and Clarity with attorney Darrell Burrow, founder of Burrow & Associates and a trusted advocate for over 30 years. If today's episode helped bring clarity or hope after an accident, be sure to follow, subscribe, and leave a review. To connect with Darrell or learn more, visit legalatlanta.com. Join us next week for another honest, faith-centered conversation about recovery, rights, and moving forward after injury.